Alrighty, up to this point, I have verified the orders, performed hand hygiene, and now I'm going to enter the room, confirm the patient, and perform the procedure. Hi there, sir. Could you give me your name and date of birth? Alrighty there, Mr. Smith. So my name is Dallas. I'm going to be your nurse, and I am going to be the one suctioning you today as per ordered by the doctor. So I am just going to start off by turning on suction machine, placing this right over you just so no mess is made. You seem well oxygenated. I would have taken the patient's oxygen. Obviously I can't do that, but I would have taken the patient's oxygen to be sure they are either oxygenated or hyperoxygenated for the procedure. And now I would open up the kit, and up to this point everything in here is sterile. So at first I would grab this, and I do not want to touch the inside, so I'm just going to go there, and then I'm going to want to take this fluid and pour a generous amount in there, and I'm going to be using this to clean out the suction while I am suctioning the patient. Okay. And then I'm going to again touch only the outside because I do not want to contaminate anything. Feed it down. And now I'm going to, I can move that out. I'm going to put on my sterile gloves. Keep a 1-inch hole. Just stay around the sides. Be sure not to contaminate the actual sterile. Alrighty, so now I'm going to go here and grab the inside cuff and put on the first glove. Next, I'm going to right here on, so be a little more compliant with me. Put on the next sterile glove. Try not to contaminate it. And now with that in, I can go here. Alrighty. Of course, I'm going to explain to the patient. So you've been ordered some suctioning for what seems to be a buildup of mucus right around in your throat area. It is going to be a little uncomfortable, but just bear with me. So now I am going to go here. I'm going to have to be sure to maintain everything as sterile. So this will be my dirty hand. This will remain sterile the entire time. Right here. I'm going to go here, and I'm going to attach the suction into the device. And this is now where I'm going to use the suction. So I would then, with here, keep this here. I do not want to mess anything up with it. I would take the lube and lube it up. And of course, just to test suctioning, I cannot move this over here. But just to test the suctioning, I'll scoop that. And to maintain. Be sure that the suction is working. As I can see, it is in fact working. So I would then go here, and I'm not actually going to lube this for the sake of the dummy, but I would then place lube on it for the comfort of the patient. And I am left hand dominant, so I'm going to use my right hand to move the patient's head backwards. I'm going to use my left hand to suction and to insert the tube. So I'm then going to push back here, and I'm going to insert the tube. I can now see it through his mouth, and I am now right about where I would like to be, the suction. I'm going to suction and wiggle it around, move it around. I'm not going to suction all at once. Now if the tube is in, I can maneuver it to be sure I'm getting everything. And as I pull the tube out, I'm going to want to continue suctioning, not leave any mess, and to be sure I get everything. I would then go here, and I will clean out the suction. Clean out the suction. And now, if the patient still needs to suction, I would then do it again. Do the same thing. Like inserting the tube, and I can see that it's right around where I want it to be. And I'm going to go here and suction. And while I do this, I would likely have another nurse or assistant to help me with the procedure by holding the patient's head, as in real life, oftentimes it's not the most comfortable thing. So the patient would oftentimes squirm or jerk their head down a little bit. Of course, I'll be talking to the patient, letting me know just we are almost done, should be feeling a lot better. And now, again, continue to just suction out as I pull the tube out gently. Perfect. And now, by now, Mr. Smith's airway should feel a whole lot better and not as backed up. And now I can pull this off, and I would throw it away. I'm not going to, but I would in real life throw this away. Put this back here, and then I would take off my sterile gloves by pinching here, and pulling off, and then getting underneath the cuff, pulling off here. And that is how you would suction a patient. Looking back at the video, I realized that I should have performed hand hygiene again prior to putting on my sterile gloves.